2.5 years ago, the 111th Congress of the United States of America passed the Patient Protection and Affordable Care Act of 2010, also referred to as Obamacare. This piece of legislation is the largest reform to the privatized healthcare industry in our nation's history of having such a system. This bill has made a historical impact on politics as we know it in the United States and will soon affect each citizen. Since its inception, Obamacare has been a highly controversial topic of conversation in the political world and has spawned a whole new level of partisan political rhetoric in this nation. But despite this ongoing political battle, the passage of the Patient Protection and Affordable Care Act was necessary for the health and financial safety of the American people. If you have had any experience similar to those of the 48.6 million uninsured Americans, you have probably found yourself on the wrong end of the for-profit healthcare system of this nation and have possibly been victimized by a healthcare system that values profit over people. A study performed by Harvard Law School estimates that an average of over 700,000 Americans, uninsured or insured, file bankruptcy every single year due to the excessive costs of our healthcare system and unfair practices by insurance companies. No other developed nation lets that happen. Even more alarming than this number is the average number of premature deaths that occur each year in America due to the lack or denial of coverage. According to a report conducted by the consumer advocacy group Families USA, that was released in June of 2012, an average of over 26,000 Americans die annually due to a lack of health insurance. In recent years, we have seen upwards of 56,000 Americans die in one single year due to this reason. The most common reasons for Americans to be uninsured are the denials of coverage based on pre-existing health conditions, soaring premiums, or the lack of employment. Out of these preceding factors, pre-existing medical conditions are the number one reason for a denial of coverage by an insurance company. This is done by medical underwriting. Medical underwriting, a process by which insurers calculate your potential risk over your potential profit by using your own health history against you, is the tactic that insurance companies use to avoid providing coverage to those who are seeking coverage in the individual, non-employer-based market. As part of the problem, there are Americans who cannot afford the skyrocketing costs of health insurance. There are Americans who cannot afford to pay out of pocket for their healthcare costs. There are Americans who are forced into bankruptcy by the occurrence of illness, and there are Americans who die without the ability to pay for their medical treatment. All of these factors taken into account, our nation had still been supporting a system that allows insurance companies to deny coverage or treatment based on the most minuscule of ailments. Reform of the system was not optional. So what is the solution? And how is it that a country that prides itself on being the richest, most powerful nation in the world allow itself to be rated 37th by the World Health Organization when it comes to their healthcare system in terms of equality and fairness? Other capitalist countries have blended their capitalistic economic principles with a system of mandatory, universal coverage for all citizens from the day they are born. Each of these nations does so either by a system of taxation or a national mandate for its citizens to buy into the national guaranteed health insurance industry. Subsidies for the poor are provided. The Affordable Care Act of 2010 takes note of these successes. The Affordable Care Act of 2010 makes sweeping reforms to the private insurance industry, but it doesn't do so all at once. Some of the smaller changes have already taken into effect. Young adults can stay covered by their parents' insurance until they reach the age of 26. Premiums can no longer be higher based on one's gender. Businesses with less than 25 employees can receive tax credits for providing insurance to their employees. Children with pre-existing health conditions can no longer be denied coverage. lifetime limits on coverage are no longer allowed by insurance companies. Both Medicare and new privatized healthcare plans must fully cover preventative procedures, and no more than 20% of your premiums can be spent on administrative costs. But how is this possible in a system that is already under financial duress? It is made possible by the individual mandate. The individual mandate states that every American must carry insurance coverage. This individual mandate has been the most controversial part of the Affordable Care Act, as every American that does not qualify for religious or financial exemption will be required to follow through with the mandate. This mandate was so controversial, in fact, that a series of court cases led the mandate all the way to the Supreme Court. The Supreme Court upheld the individual mandate in 2012, ensuring the survival of the most important component of the healthcare law. Since the inception of Obamacare, a number of fallacies have made headway into mainstream political rhetoric. Citizens often do not understand the bill in its entirety, or are often only familiarized with the talking points of politically biased media outlets. The most common of these fallacies is that it is creating a universal healthcare system like that in Canada. Unfortunately, that is not true. The Canadian healthcare system is a true universal healthcare system as opposed to the social insurance system that we are slowly integrating into. Another myth: Americans will have to wait weeks or months for life-saving procedures. This is not true, as the only foreseeable shortage of practitioners after the influx of new patients will be in the area of family medicine and general practitioners. Another fallacy: the government will be deciding your health decisions. This is also false. Each individual will have the ability to select their own healthcare providers exactly as they do now. The government is not intervening in the direct care of any patient in any capacity. The only changes are in patient responsibility. In conclusion, the Patient Protection and Affordable Care Act has been decades in the making. Since the inception of the private for-profit health insurance company, consumers have been subjected to and victimized by the unfair and deceptive practices of said companies. Health has always been put at a lower priority than profit, but not any longer. Americans will no longer be denied coverage or care due to their previous health history. American citizens will no longer lose all of their possessions in bankruptcy proceedings because they became ill. Innocent Americans will no longer be left to die because they did not have the means to pay for life-saving treatments or procedures. Despite the political rhetoric from both sides of the aisle that have impacted public opinion, humanity has won a battle over corporate profit. Americans will be freed from their oppression by a system that was created by a constitution designed to protect them. As Harris Wofford once said, a constitution that guaranteed the right to an attorney if you commit a crime should guarantee you to the right of a physician if you get sick. This is Kristen Schaefer, signing off for KC News.